brothers and sisters in Gaza, Nurse Kathy here, and today what I'd like to do is go over some activities you can do with your baby to help with their brain and their physical muscular development. These are activities that can be done for any baby, but are become really important tools when we do these with babies who are born with some challenges. A premature baby, a baby that undergoes a traumatic birth experience, or even sometimes our young children who have had a brain injury. These are all things that can help with our brains to rebuild the connections with our cells that do the thinking and help move our bodies. So before we get started, I want to say, please make sure you follow your doctor's directions. If you have any questions about what I go over here, please ask your doctor, or even take the video and show it to him, and he or she could give you more maybe ideas or something that's specific to your individual case. All babies are different. They all progress at different times, even healthy babies. But with our babies who are challenged, that's who we're really targeting today. So before we get started, I want you to just take a deep breath and relax. These should all be just fun for you and your baby. The first few activities that I want to go over with you are sort of a warm-up. These activities, any one of them in the video can be done at any time throughout the day. They do not need to be done in order, but this is sort of the way, if you came into the office, we might begin with these activities, we'll progress to some physical activities, and then we're going to wind down with some relaxation. To begin with, the first thing you want to do, both in doing these activities and anytime you put your baby in any position, is you want to make sure that their muscles and their joints are in the right alignment. And that's particularly important with our little babies, our premature babies who are born very early. Their muscles aren't developed. Some of our babies just have brain diseases or injuries, and so they may not even be able to hold their head in this position. It might loll over. So what we want to do is take anything you have. This is a t-shirt. You can take a pillow. You can take just about anything you need. And if your baby is having trouble holding their head in that midline, you just want to take that and gently put it around there. And that gives that baby some support. You can also do this if your baby is sitting up a little bit, or whatever position you want to be in. Use your props. Make sure they're in a good position. And make sure your baby's kind of happy. They might not, they might be hungry or tired, or maybe their diaper needs to be changed. And anytime you have that, your baby is not going to enjoy this, and you're not going to enjoy it either. So if that's the case, just stop. No reason to go on with it. This is supposed to be pleasurable for everyone, and it also is going to be a lot more effective when you can do these things, and everyone's happy doing them. So we have our baby lined up here, laying out this baby's doll. I can't straighten her legs, but pretend. And the first thing we're going to do is we're going to speak gently. We're going to start talking to the baby. We're going to stroke a little bit down their nose, maybe down their bodies, down their arms. You want the baby to sort of get a sense of what belongs to him, what body parts. These stroking, gentle movements are relaxing your baby, and they're sending messages to the baby's brain cells, saying, developing sort of that the nerve connections we need, so a baby becomes aware of where he begins, his body. Babies aren't really born just knowing that. Again, what the activities, these sensory activities, are really more targeted for your baby's brain development. And the next set we're going to do are going to be more targeted to the strength and flexibility and movement development.